And now we are going on to the final segment for the evening. And to open this powerful final segment, we'll begin with a fireside conversation with my next guest. And following that, we have a panel discussion with some cancer warriors here, and you can also ask them some questions after we're done. My next guest is someone who holds an executive master's in healthcare administration from Zayed University. She's a co-faculty member in the general surgery residency program and adjunct clinical assistant professor at Gulf Medical University and Khalifa University. Her excellence has been recognized with the Emirates Women Award by His Highness Sheikh Ahmed bin Saeed Al Maktoum and an honor by Her Highness Sheikh Shamsa bint Hashir Al Maktoum for her leadership in women's healthcare and medical education. Earlier this month, she was also honored with the Breast Surgeon of the Year Award. The Breast Surgeon of the Year Award at the 5th Annual Health Awards 2025 in recognition of innovation and excellence in healthcare across UAE and is a well-deserved recognition for her outstanding contributions to the community. Ladies, please put your hands together and welcome to the stage Dr. Nahed Balalaa. Dr. Nahed, thank you for joining us, and you definitely So we'll start with a fireside chat with you, and I've got some questions, and let's start. You've nearly spent 2 decades, you look really young, mashallah, 2 decades at the forefront of breast cancer surgery, and you are definitely one of the pioneers of Oncoplastic breast surgery in UAE. What inspired you to specialize in this particular field?
First of all, I'd like to thank you for the introduction. Thank you, Sabah. I'm really happy to be here leading this great event. Actually, this month is really full of events. It's a pink month. We love it all, not only as a doctors, also every female. We are waiting for the awareness, the hope, the care, and the support for every single female here. So, thank you so much. I'm really happy to be here today. And back to your question, which is, I think, every single lady is asking the same questions. Why you choose this profession? What inspired you to be a surgeon? It's very simple. Just to help a female. Female want to help a female. Because as you know, in our culture, it's male-dominant culture. Especially as Emirati or Gulf or Arabs in general, I think everywhere, no one wants to be exposed to a male. So, I chose to be a doctor because I was young and I always first in the class. Yeah, that's really, that's a reality. And then I chose to be a doctor because in my time, everyone, whoever the first in the class, always would be called as a doctor by default, by your parents, by your family members and colleagues. So, and then, because I'm a competitor, so I said, why every surgeon should be a male? So I chose to be a female. I chose to be a female surgeon. Though it's very tough specialty, by the way, it's not easy. And before you become a breast surgeon, you have to go through a general surgery, which is you have to be everywhere. You have to cut everywhere. You have to learn everything in the body, especially anatomy. And then. Here, back to your question, I select and I choose to be a breast surgeon where I can treat only female. And then there's another question, why do you choose breast and cancer, not plastic surgery? Because really I would like to feel and to help the lady who is in pain. not only physical pain, and as my colleagues talked earlier today, it's a mental. And she needs like a psychological support more than physical support. Believe it or not, she can talk to you many things, not even she shares with her husband or her brother or sister. So every lady who walks to my clinic, like if she's old now, she's like my mother, or if she's young, she's like my sister. So we chat, we talk. She called me even after hours to discuss many things. What do you think, doctor? This is what happened to me. So that's all behind my story.
Right.
Simple as this.
And when you actually say that you wanted to help women, that was one of the main things. And I'm sure you've seen hundreds of women who actually walked into your clinic, your room, facing one of the toughest battles of their life. How important is a person's belief? You did mention something about not just the physical healing, but also mindset. How important is a patient's belief in their own healing? Like, does mindset really affect the medical outcomes?
See, as a doctor, in general, not even a surgeon or breast surgeon, as a doctor, first impression is the last impression. When the lady walks to your clinic and she's new to you, that's the time when you build that trust between you and her. And this should be in every doctor, not only a surgeon, because you want to know she will come back to you or not. She trusts you or not. And they will mention it. They will say, Doctor, I went everywhere, I believe on you and what you said to me. Because if I told her you have cancer, she will go here and there. She will show around just to confirm it because she's in denial of this. So that she will come because she had a belief that what you said to me and that you said, I will be with you, I will help you, I will be with you from the beginning of the journey till the end of the journey. Even after you finish your treatment, come back to chat. Tell me what happens, what's news in your life, what happened to you. So this is what really inspired me also. That every case I found it as a challenge, let's give more and more. Because every lady is different than another. I used to tell my patients like every case is different than another case. So you see many ladies, different nationalities, different age, different background, different profession. So you have to talk with her in the same, I can say, same mentality, So in order to convince her, yes, some it will be okay, others they will still, they need psychologists, they need psychotherapists, whatever. Because, we're all different. So this is my message even when I tell my students. You can be a doctor, but who will be a good doctor? That's very important.
And actually, we had one of our previous speakers also mention how she had gone from doctor to her doctor, and it took 9 to 12 months to be diagnosed. And finally, she went back to the doctor she trusted. And it's always that.
It happens every day, but
Right.
and I'm sure it happened with many doctors here.
Yeah.
Because I told you, first impression is last impression. You have to convince her. You have to tell her. You have to tell her all the options around. You put everything on the table and tell her, I'm here to help you with the decision. This is the way how you build the trust.
Right. And you are also known for your compassion as much as for your skill, definitely. How do you protect your own emotional well-being when you are caring for so many patients and all these patients who are fighting such heavy battles? How do you protect your emotional well-being? Face says it all.
Really, I found my relief when I sit with my family. I'm very close to my family, by the way. And with my niece and nephews, I love to play with them. I don't have kids, I'm not married, but I like to sit with the kids. I love to talk to them and see how they think. And also traveling, sometimes to disconnect. That's very important to me. Every quarter I have to take 1 week, really disconnect. That's me. But again, some patients will stuck in your mind. You cannot forget. You will just remember, dream about them, what happened. You give a hand over to your colleague because you are away. But this is really, really very important for the mental health of the healthcare profession. In order to come back fresh and recharge. Right. That's very important.
Yeah, of course. And of late, many people actually say that cancer rates seem to be rising globally. even sadly amongst younger individuals as well. From your medical perspective, what lifestyle habits or environmental factors you think are contributing more to this increase, and what do you think are the ones we can change practically?
Well, there are some factors which is in our hand, which is the lifestyle, and there are other factors which is not in our hand, like the genes, the family histories. These are not in our hand. We didn't choose. No one can choose their parents, right? But what's in our hand, it's the lifestyle. Like this one is centered, really is amazing. So,
Doctor, is it actually true that the rate of cancer is really increasing?
Yeah.
Or is it just that we are more aware of it?
that's a good question. It is increasing worldwide, I can say that. And because of the increased number of the awareness, we discover it early now. Plus, the government, the UAE government actually, are really encouraging everyone now. No one can renew her insurance without 1 gram. Yeah, it's a mandatory. It's a mandatory. You have to do it if you are 40 and above. Otherwise, you'll be self-paying. Yes, that's the leadership really encouraging this out in our country. Yeah, that's one of the things. And the other thing, as you see, we are investing more in the change lifestyle, change of health, more like fruits, vegetables, healthy foods everywhere. Even now there is a new business, healthy food.
Yes.
That's fast track, if you notice. The walk,
Mm.
everywhere, gym, everywhere.
Self-aware.
Yeah, and by the way, now everyone is educated, social media, everyone is educated. These are the lifestyle which really in our hand. And there's no a specialist for lifestyle. Now the family physicians, they have some specialization in modifying lifestyle. There are some physicians specializing in this, how to help people to modify their lifestyle. And by the way, it's not our job also as a doctor, it's everyone. Everyone knows how to change it. Avoid smoking, alcohol, drinking. It's not for job. No one wants to harm herself or himself, right? Obesity. It's not only for breast cancer, for every cancer. Because this is fat. Fat is increased estrogen. Estrogen goes to breast cancer. It's very important. So these factors is really, ladies, in our hand. We can change it. If you have a walk for half an hour a day, we walk during our duty, right? Especially those who are doing like office job. Go and have a walk sitting all the time. Use the stairs instead of the lifts. Many things you can create it. At home. Change whatever you have, like white sugar with no calorie sugar, brown bread. Very simple things. Start to introduce it to your house. No one will like it in the beginning, but they will get used to it.
True.
They will get used to it. Like I know my brother, he used to have a tea with sugar. Now, tea without sugar. Coffee with sugar, without milk. It's not like, make it as a habit. It doesn't mean that you don't drink tea with sugar or coffee or latte. Drink it, but everything with balance.
Yes. Yeah. That's interesting. This is some lifestyle tips definitely that we can all
Be
incorporate.
the ambassador.
Yes.
Be the
Your own health.
ambassador to your house.
Yes.
Yeah.
True. And you've been in the medical industry for almost, two decades now. And what are some of the biggest medical innovations that you have witnessed in your career that give hope to women today? Like, has technology and surgical innovations completely changed the way breast cancer is treated? And also not just treated, but diagnosed as well, I think, early.
I'm sure everyone heard about artificial intelligence now. Yeah. So, from surgery perspective, not yet as a breast surgery, but there is for the mammogram, the software for artificial intelligence where it can expect or predict like 30% who can have. It's a software. We'll try to introduce it now in the mammogram. Yeah. And regarding surgery, which is my profession, we have some materials we use now, which is non-invasive, not like before, where you localize the lesion, non-palpable lesion, not the mass which you feel. And you can go and get the tissue around it. Yeah, and it's in our hospital, in Cleveland, in Tawam, in all big centers in Abu Dhabi now. We are all as a surgeon are using it.
That's really nice to know.
I'm so sorry, I'm totally interrupting you.
Yes.
It's okay.
So
For the,
Yeah.
I not only have any question about
Yes, please, yes.
So how accurate or genetic testing, and should we all be doing things like genetic testing as well? Because that's available now.
Yeah. Genetic testing, we have BRCA1 and BRCA2. BRCA is the genetics for the breast cancer. Not necessarily who have family history that she will have breast cancer. 10% can have. And not every tumor or lump you have, it should be cancer. 80% to 90% is benign. That's for fact. But being a female, it's a risk factor. It's a risk factor itself. Being obese, it's a risk factor. Contraceptive for a long time, it's a risk factor. So we do genetic testing. Actually, the oncologist and the genetic physicians will do it. Usually, we do it for whoever is diagnosed with cancer because we want to know if shall we take the other breast or not, with the ovaries and the uterus. But it's costly and we have to pay for it. But not every hospital do it here. Whoever have like a license for genetics. Yeah.
Can I ask a question?
Yes, please.
It's true that my mother has breast cancer and they've stopped her milk and sugar completely. So, does that attribute?
No, not 100%. She can take, but make it minimum. Yeah, there is a concept that I have to stop sugar totally because cancer lives on sugars. Yes, sugar or carbohydrate is not good for cancer, but you cannot tell the patient, do not take this. I never said this to my patient. Like a diabetic patient, they should not take sugar, right? But I tell them, okay, slowly, there are substitutes for the carbohydrate, you can take it. You know what I mean? But you have cancer and you need or you have to follow up, regardless. If she has a cancer, she has to follow because we don't want it to recur again or to come to other breasts. You know what I mean? So if the breast cancer recurrence again, it doesn't mean because she's not listening. That means because it is aggressive one. That's why it comes back. And the follow-up is very important. Okay, screening is very important, but whoever diagnosed, she has to follow. I have some of the patients who tell me, okay, I'm cured. Yes, you're cured. We, non-cancer ladies, we have to follow. We have to do every year, right? Why don't you do it? Just, it's a message how to deliver it to the lady. Very important. And she will tell you, I have a lot of my patients, if you tell me jump from the window, I will jump. That trust. Just tell her this way, she will accept. She will accept and she will tell her parents or her husband, no, doctor didn't tell me this. Let her enjoy, let her live her life, it's fine. But not to stop it totally. And I bet you if she can't stop it totally, she cannot. Yeah.
It makes you crave for it more too,
Yeah,
right? If something
she will challenge you to take it.
And she's quite disciplined, but even then, like, she likes milk in the night, we stop that. So, some doctors say it's fine, some doctors say no.
Yeah, to me it's fine, but minimize. Yes.
You are a surgeon, you're a teacher, you're an advocate for women's health. How do you see the future of women's health here in UAE changing over the next decade?
Incredible change, remarkable changes. You know, the leadership really investing in women. There's no question. Emirati women. And you can see that Emirati women and women.
Yeah.
By the way, we are more advanced than men, with respect.
100%.
Everywhere.
Thank you.
If any good with respect, so. I'm telling you, if you want a decision or if you want things happen, you have to have a woman around the table.
Yes.
Trust me, that's very important. So I can see that there is a lot of investment in the woman. There is a lot of investment in the healthcare woman everywhere. If you notice now in every clinic or every hospitals, they will have a sections for ladies.
Yeah.
So, and they will put the leader there, it has to be a lady.
Mm.
So, I can see that there is a lot of things coming and a lot of changes. So
Awesome.
that positive side, of course.
Awesome, that's good to know. And if you personally can redefine one aspect of how society views breast cancer, whether it is fear, whether it's silence, the stigma attached to it, what would you want to change the most and why?
Seriously and honestly, when you break the news to the lady, everyone she will show her different response. Someone will be in silence, someone will tear in silence, someone will fall, someone will cry, someone will keep quiet. She will feel this, that I have this stigma, the world is black, I will die tomorrow, I lost my job, I lost my life, my husband, my feminine part. First thing come to her mind, okay, you will remove my breast. Oh, I will have chemotherapy. Here, the counseling started. Here, your humility, not a physician, and not as a doctor. You tell her, it's fine. This is better than a lot. It's the way how you support her. And here you build the relation. You know what I mean? So I will tell her, I will be with you. This is the secret. And I always tell my patient, I will be with you. And I give her the number. Whenever you have a question, just call. Whenever I have anything, can you consent, just come. She will not come, but give her the trust and the support. Because she wants to go and cry in her husband, or her kids, or her sisters, or family. But she will feel that she's not alone and you will support her. And regarding the stigma, really the breast cancer now, it's less than brain, or bone, or stomach. It's really, it's curable. It is curable. We have advanced technology here. We have advanced medications. We have experts from everywhere in the US to treat this. And the number of Emirati patients who travel abroad is much less than before, to be honest. So this is really assuring. So assure her, be with her, support her, and she will admit. The first thing to believe and think, admit that it's happening. No, you can't change it.
Exactly.
So she will cry for some time and then she will admit and she will come over. I have patients, she become pregnant, she got married, and they come to invite me for their wedding, or they come with their kids. It's fine, it happened. And we take photo, we tell them, entertain, we call them every year for this October, to their story. They become more strong than us, by the way. Because they went through it. They went through it. And I will tell them from my side, as a surgeon, the surgery is the least painful part. You'll have the pain 1-2 days and that's it. She thinks about the radiation and the chemo and these things. But again, also it's just the time. It's just the time and it will pass. Just counsel. And if you see that patient really need a psychologist, you just refer. They are the experts.
Right, true. And speaking about support, breast cancer or cancer in general doesn't just affect the person, it also transforms entire families. What role do you see that loved ones can play in a breast cancer patient's or a cancer patient's healing journey? And how can they best support this patient?
Yeah, this is very important. That's why I love my family. Because really the family are the biggest support. My family, they are the reason where I am now. So I'm sure, and every family, always I tell my patients or my friends and colleagues, you don't have to tell me. Go and tell your loved one, whoever you trust, regardless, your brother, your sister, your husband, whoever. I have one patient, the one who shaved her hair because she started chemotherapy is her father. You know, it's just the family. And of course, when the patient will come, every patient, whoever she will come with the big bad news, she will come with her family. Of course, because she comes, doesn't know what's happening. She wants someone with her. So when you just get the news or you talk to her, you should counsel him or her as well. Now this is your role. You have to be with her. Don't let her sit alone. She will keep thinking.
Yeah.
That's very important. Let her sit always with you guys. Go out with her. So family is big support.
Family lives, they made me remember like this last year, my whole 2024 with cancer. And my brother flew from Canada, my daughter flew back to the UK. And the family is so important. And I remember nobody was sad, we were all laughing. For
Yeah.
example, my brother.
Very important.
Yes.
Also, you know, when you're like so sick in hospital, my brother took all the pictures imaginable.
Yeah.
And now we laugh about it. Like, he said, oh my god, I got all these pictures.
Just
like,
take photo and picture. You will remember.
yeah.
You will
Yes, now
remember.
we laugh. It's like me screaming or laughing or and what they did like first time I went out, I was in a wheelchair. 3 months. They took me to Galleria Mall. And what the fuck, they left me in the middle of the atrium and then they ran. But I was laughing, so it was very important to the family to be very humorous. We talk about everything except cancer. So this is very key actually, the family's involved and they
Very
remember. So now we laugh about all the ugly pictures, you know. So yeah, this is
Even when I sit in my room and I do something on my laptop, I feel like class it's closed. I went down. Even I love when my mother shouts at the mute. I love it. I want to hear. I want to hear everything. Do this and do that. My brother will come, the niece will hear. You know, I love this. This is really
all the normal things.
normal
Yeah,
things.
yeah.
We are human.
Yes.
We are human. My life is not only clinic or 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 hospital. Go with your friends, see what's happening, engage with them, what's happening, what do you have today, where we'll go today, who will come today. It's very important. So this is, I feel, they are the biggest support.
As a doctor, I mean, it's such a hard job.
Yes.
You do obviously the technical side, but to be strong when you're looking at the patient, like, it's incredible actually because the patient really takes the lead
Yes.
for the doctor. So I think it's like true. Because I do think when you go back, you know, some cases that are very difficult, you know, who passed away.
Yes.
How does that affect you when someone's not made it through? How when you go back? They go to their treatment and
You know, it happened. It happened. And you know, it happened with time. Like, doesn't mean that we don't have feeling. We have feeling. But with the more you see, the more you become strong. You know? That's the way I can say it. Yeah, it affected me. It touched me so deep. But this is life. We will go all in this path. Either with cancer or car accident or MI or whatever. But what made me happy that I did my part. I did my part with her, you know. I supported her at the end. So this is really
Awesome. This is actually a great transition into the panel discussion as well because the speakers who are talking now will be on the panel discussion. So I think I'll just invite them on stage. But thank you so much, Dr. Nahid, for